This is the second video for today, sabi ko. And good morning. Today is Sunday. I think third day video pala nag-expose ako kanina madaling araw. Anyway, good morning. This is Doc Chris Scrubby MD. Still, ano ba? So, yung last video natin is mycoplasma. Papunta tayo sa HIV. HIV. Okay. Ito, madalas kasi meron pa rin problem sa definition on HIV, no? Kasi, ano yun? Sinasabi, ay, HIV. Ay, AIDS. Magkaiba po yun, ha? Magkaiba ang HIV sa AIDS. AIDS is the latter stage of human immunodeficiency virus infection, while HIV is the virus. HIV infection, that is the general term for the disease or the infection of the human immunodeficiency virus. Now, sa HIV, yun nga, we discussed earlier na mayroong rapid increase and also huge problem on the increasing number of patients sa Philippines that are diagnosed each day about on HIV. Kasi sabi nga nila noon parang kulang pa sa isa kada araw noon. Ngayon, kada oras na, 1.5. Sabi nga, 1.5 per day. 1.5 hour per day, may nada-diagnose ng HIV. So, alarming, di ba? So, ano ba yung mga symptoms? But before you talk about symptoms, you should always understand na the person that is usually infected with HIV, there are risks na meron siya. You should identify what we call high-risk sexual or a high-risk behavior, to say the least. Hindi lang sa sexual. High-risk behaviors, they comprise of certain activities na pwedeng nagawa niya through the course of his lifetime na pwedeng maging risky activity that would be the reason why may possibility na pwede siyang magkaroon ng HIV infection. So, pag ganon, usually, you have to do a thorough history for the patient. Sa patient na mga ganon, high-risk infections, una, tanong nyo, pinakamahalaga is, you dwell on the past medical. If the patient had, the patient had a lot of recurrent infection, doon magsuspect siya na yung isang doktor. So, recurrent infection, let's say, sa isang taon pa lang, the patient already had history of pneumonia for 4, 5 times or 3 times. Kasi hindi typical na magkaroon ka ng pneumonia kada buwan or every 2 months. Inuubo ka lagi. Okay? You would suspect, no? Laging mababa ang resistensya pag ganun. Then if you go to the, let's say, sexual history. So for the sexual history, kadalasan tinatanong nila multiple sexual partners. That's why. Ano pa? The type of sexual activity. So if the type of sexual activity, yung either syempre, the conventional siyempre, pwedeng medyo, kasi sensitive yung topic ng paggalito eh. If it's done usually per sexual organ, that both, if sexual organ meaning the phallus or the penis and the vaginal or so the female, no? So penis vagina or penis anus, no? And then pwede rin namang oral. Okay, yung mga yon. Beyond the traditional, yung dalawang na nabanggit ko earlier, yung dalawang yon, high risk yon. Okay? Aside from that, if let's say they're doing the sexual activity with another person, so pwedeng more than three sila, that is also high risk, especially if the other partner or one of them, okay, one of the three or one of the, right, one of the two has a history of multiple sexual partners. That's high risk. Ano pa ba? Um, Having fun of multiple commercial sexual activities. So, commercial meaning, syempre, yun, paid sex, mga ganyan. That is very high risk, especially if the situation is the woman or the paid sex worker is uh, not tested, no? Sa atin sa Philippines, bawal kasi yun eh. Hindi siya encouraged. Ang prostitution is not, okay, not not legal, but there's always mayroon at meron pa rin ang ganyang type of business. Okay, patago. Ano pa ba? Yeah, from the news, ito yung madalas. Um, male having sex with sex. Ay, male having sex with male. So the M2M, tata ba yung term? Or MSM. So kasi yun, this highlights the reason why nagkakaroon tayo ng uh, spread. Pero I think that would not fully explain why. Kasi parang it highlights uh, homosexual activity. Pero that's not usually the case kasi usually sila yung talagang nagpapa-test. Most of the time, nafe-feel nila yung symptoms. And in certain situation, sila lang kasi yung nagpapa-test. And for if let's say male having sex with female and hindi madalas nababanggit na yung traditional sexual activity, nagkaroon ng infection kasi the partner had an affair, okay? Pwede rin naman kasi yun. If maganda yung case detection natin, baka iba or pwede pa rin naman yun, male having sex with male, ang reason why may increased infection, meron din namang pwedeng male sex with female na infection, okay? Until we arrive at a uh, case detection na medyo na nagkakaroon ng awareness that everyone that with high risk behavior will get tested. Yan. Yan yung mga sitwasyon na yan. Pwede tayo makapag-rely on ano ba talaga yung score with regards to infection or spread of the infection. As of now kasi sila uh, especially here in the Philippines and other countries, madalas ang nag-advocate dito yun na uh, the community of uh, LGBTQ kasi usually naging struggle nila yan yung highlight of the HIV infection ever since the 1980s and 1970s kung kailan siya na identify kasi some of the known people who got infected are homosexuals, no? Uh, well, one of the people na very much known for having infection of HIV, maganda rin makita kung paano ba niya nakuha? Sa Philippines or kahit sa US? Siguro sa famous people in the sa world. Tingnan natin kung sino yung mga na-infect and publicly, okay, presented themselves that were infected with HIV. Okay, tingnan natin. Okay, this is from, well, people celebrities with HIV. Okay. There are a lot, marami. Well, the most famous of them is Magic Johnson, and he's an advocate naman na, no, of this. So, Magic Johnson, na alaman natin, is basketball player naman siya and is regarded as the greatest point guard of all time in NBA history. So, very famous talaga siya. And then, kailan ba siya na-identify ng HIV? That's a good story to dwell with. Siguro another video. Charlie Sheen. Well, from the, anong kwan dito? Anong, anong TV series? Meron yun eh. Charlie Sheen. Tingnan pa natin. Actually, sa lahat ng nilabas si Google, yung dalawang yun ang kilala ko. The rest, well, how about the Philippines? Okay. First known Dolzuro Cortez. Hmm. Oh, I think siya nga. Let's go to Wikipedia. Natin. Okay. Filipino AIDS victim was the first Filipino to publicly discuss that she has AIDS. Okay, may film that was adapted from his life. So Dahil Mahal Kita. Oh, it's an old film, 1992. So, actually, very sensitive kasi ang topic on HIV. So, sa mga ganitong sitwasyon, these people had the courage to tell everyone, okay, how they contracted. And it's for an awareness campaign on how people might get the infection, okay? And she is the first one to openly admit to had HIV/AIDS. And I think umabot siya sa AIDS. And again, AIDS is the latter stage wherein the body is very sick already after the infection. Yung immune system niya sobrang down na. Okay? So that is Dol Zuro Cortez, died in 1992. Kailan niya na kwan daw? Kailan kaya niya na contract yung infection? Hmm. So he works as ano to? The film begins with a brief examination of Cortez's pre-AIDS life, initially small village with her husband and three children. Cortez left to move to Manila, and she was involved in a number of partners. Okay, so this is from the movie pa lang naman. So it's a movie adaptation. Number of partners. In the second marriage, a rich foreigner, did not last long. So multiple sexual partners. To support her children, Dolly begins an all-woman contract work agency. This also serves to facilitate her love of nightlife. One night, the Cortez collapsed in the dance floor of a nightclub and was taken to hospital, and she was diagnosed with AIDS. Oh, AIDS agad. And Cortez became instrumental in spreading AIDS awareness in the island. Okay, it was the first film on AIDS in the Philippines and provided a name and a face among 50 recorded lives that were lost in AIDS in 1992. Oh, okay. The film was utilized as a focus of discussion by some healthcare personnel to express their thoughts, opinion, and recommendation regarding the use of cinema as a powerful tool for AIDS information dissemination. That's why may mga adaptations about sickness. I think meron Meron ding movie adaptation on cystic fibrosis, no? That is nasa Netflix. Meron din mga movie adaptation about Parkinson's. Okay? Meron ding movie adaptation about Alzheimer's. May mga ganyan eh. They are touching. And it moves. Pero this is important to have if may mga movie adaptations. They should be consulted with the medical team para lang din maging accurate yung depiction. Kasi most of the times may mga production team na hindi na nagkonsulta, medyo mali-mali yung adaptation. Lalo na sa mga TV series. Meron yung naglagay ng NGT sa kwan, sa bibig. Ay, ano to? Sa ilong or ay NGT. Oo naman sa ilong. Hindi siya NGT, ano to, IFC sa ilong. Ay kung, naku, medyo mali. Or yung host, napagkamalang, ano to, MECVEN. So, yun mga yun. Dapat meron din sa consultation ng medical advice, ay medical team on what's the appropriate scenario. Dito naman sa HIV AIDS campaign, siguro i-run down na din natin to sa susunod na video. So, ano ba yung dahil mahal kita na film? I think it's very old, so maganda rin siyang daanan. Mayroong isang, sino yung second? Sarah Jane Salazar. Okay? She is the second one. Okay? An educator. And the second Filipino to go public with AIDS. At age 19. Ang aga. In 1994. So, she contracted HIV from a foreign customer while working as a club entertainer. Her life story made into a movie, The Secrets of Sarah Jane. Sarah Jane, Sana'y Mapatawad Mo. 1994, starring Jelly de Bellet. Who won the Best Actor award in the role in 1995 with Gawad Uriel. So, controversies. At age 1997, 21, and already an HIV educator, Salazar was charged of child abuse, of having sex with a 60. Okay. This is made somewhat sensitive. Well, age 21, nagkaroon siya ng sexual activity, sexual contact with a 16-year-old bata. She then became pregnant and gave birth to a son. Atizado said that they were lovers. He later tested positive for HIV. Ang problem din dito, if ever, let's say, he tested positive, siguro sa ibang tao, sa ibang scenario. If, let's say, for example, he had sexual relationship with a person that is known to be HIV positive, pero they still continue the ano to, sexual act, pwedeng makasuhan yung tao na alam naman niya na diagnosed na siya. And it's put on record na diagnosed na siya na may HIV pero sexual worker pa rin siya. Sex worker pa rin. And na-infect mo yung customer mo. Well, that is punishable by law kasi aware ka na. Then nagbibigay ka pa rin ng ganitong high-risk activity. Well, parang it defeats the purpose why you got tested in the first place. Pero before that, syempre, sa amin, we advocate na you should have a safe sexual activity or sexual relationship. Okay? Mahirap kasi kapag ganyan, so sobrang dami, magkakaroon ka ng higher chance of contracting the infection kapag multiple sexual activity or sexual partner, no? And hindi pa siya protected sex, like using of contraception or barriers like yung condom, no? At the time baka hindi pa siya uso yung condom, so yun, it's that would be difficult, no? So key facts, madami na tayo nadaanan, hindi pa tayo dumaan sa reason ba ano ba HIV and AIDS. Saan tayo sa WHO? Maganda sa CDC ito. Okay. So, key facts about HIV. Usually, yun nga, the first recorded infection of HIV in humans came from the type of infection from chimpanzees in Central Africa. So, may dalawang strain, HIV-1 and HIV-2. And I think the most common strain here in the Philippines is HIV-2. Tama ba? HIV-2 ata. Basta ba yung most common strain sa atin. Yung isa, more on South Africa. Ito? There are other strains in the South African region. Kaya nag-start siya sa Africa eh. So, in this situation, na yun nga, nanggaling siya sa chimpanzee. And, well, siguro we can imagine kung paano siya nakuha ng isang tao. So, it started from the simian immunodeficiency virus. It was probably passed on to a human when humans hunted these chimpanzees for meat and came in contact with their infected blood. Okay, so hunting. For decades, as HIV slowly spread across Africa and later on parts of the world. The virus existed in the US since at least the mid-1970s. Pwede rin naman earlier kasi hindi pa natin na-detect yung infections. Lalo sa mga infections na hindi na-document ang reason bakit nagkaroon siya ng sakit. How do I know if you have HIV? Well, usually the symptoms will present, or if you have high risk behavior and you had recent infections na pabalik-balik despite getting treatment, the doctor might see or might evaluate your immune system and get you tested. Now, how many HIV tests are quick, free, and painless? May self-test. Okay, this is in the US. Sa atin kasi, I think if you ask for a test in public, there's a stigma. And baka pag i-judge ka ng mga tao. May sa atin, meron confidentiality ito. You could go to a clinic that offers HIV testing. There are clinics in the government that will be helpful for people who want to get tested. And syempre, interviewin ka, your name will not be placed on the result. May mga code yan. Para lang din ma-avoid ang spread of information about you kung meron mang positive or negative na resulta. Okay? So what are the symptoms? Most people have flu-like symptoms within 2 to 4 weeks. And then yung symptoms na yon mawawala. That's the window period. And then they might emerge after several weeks again to provide a more worse infection. So, marami. Very generalized kasi ang infection of HIV. Kasi yung HIV, hindi naman siya yung actual na nagkakos. Bumaba kasi yung resistensya mo and mas madali kang kapitan ng sakit. Okay? So, ito's typical to eh. Fever, sore throat. Let's say if an upper respiratory tract infection. However, if you have multiple swollen lymph nodes, okay, generalized, meaning madalas yung infection, may mga adenitis ka, and it present also with a rash, and then muscle pain. And then, common kang magkasakit and coughing. You are prone to have infection of TB, okay, and then you get mouth ulcers or fungal oral candidiasis. Okay, mga yun. Well, chances are your immune system is low. Kahit naggagamot ka, hindi ka gumagaling. That is the time na kailangan you seek consult. No? So, again, the first thing you need to do is, assess if your condition is not improving, go back to your doctor. Okay? Wag kang mag-doctor shopping. Wag kang tatalon-talon sa isang doktor. Doon tayo na-delay ng treatment kung kung hindi ka satisfied sa treatment ng first doctor mo, naghahanap ka ng ibang doctor. Para lang ma-document niya yung gamutan mo is dapat sa isang doktor ka para malaman niya kung nag-i-improve ka ba o hindi. And then makikita niyo yung pattern of your infection. Now, stage 1 infection of HIV, large amount of HIV is found in the blood. So as early as the flu-like symptom, despite treatment for pneumonia, ganun, or upper respiratory tract infection, or may mga symptoms that are highly inconsistent with the typical na sakit, pwede kang matest sa stage 1 agad. Okay, if na-test ka na and then na-identify na nabanggit mo sa doktor na you have a high-risk sexual behavior, like multiple sexual partners, ganun, they would offer you the test. Okay? Aside from that, they would offer you other tests like yung Hepa B, syphilis, ganun, together with HIV. No? Kapag ganun yung sitwasyon, they would, it would add up with the increased case detection. Take note, isang doktor. Kasi kapag bumalik ka sa bago, ay pumunta ka sa bagong doktor, ang mangyayari dyan, ulit ang history PE, maulit na naman. Unless matanong nila sa first consult na meron kang high-risk behavior. Okay? That is usually, kapag ganon, nakakatch naman agad. Okay? Just be open to your doctor with regards to your symptoms and your other past medical history. Okay? So, kapag nakuha, na-test ka, the next step kasi dyan is identify kung ano ba yung level of your immune system with regards to combating infection. Kung candidate ka ba ng antivirals. Okay? So, stage 2 naman, chronic infection. Dito kasi, di ba sabi ko, merong flu-like symptom for 1 to 2 weeks, then biglang mawawala. The window period, and then your chronic HIV infection would take place. So, chronic HIV infection, usually, pwede nga latent. Ito yung time na wala kang symptoms. Pero, biglang nagkakaroon ka ng symptoms afterwards. So, for the chronic HIV infection, usually, it would be the period na may transition siya to full-blown AIDS. So, this may last for decades before mag-present ng stage 3 or AIDS. So, for stage 3, yan nga, most severe stage of HIV infection, people with AIDS have high viral load and easily transmits HIV with other people. And they are usually affected by opportunistic infections. Sa mga pasyente namin na are suspected with AIDS, they have infections that are not normally present in a healthy individual. Take note, it's not usual to find oral candidiasis or fungal infection in the esophagus or in the mouth, no? Alipunga sa bunganga. That's not usual. It's also not usual for you to have brain abscesses. Lalo na if the patient is, let's say, nag-start lang siya sa cough and colds, and then after 3 months, nag-develop siya ng chronic cough, and then meron siya mga multiple lesions in the brain kasi nagkakaroon siya ng episode of seizure. Okay, so magtataka bakit nagkaroon siya ng ganun? Ano pa ba? The patient has a more severe course of tuberculosis and may presentation of pleural effusion or tubig sa baga kahit naggagamot siya. So magtataka ka din ulit doon, bakit malala yung TB niya? Okay? Ano pa ba? Yung skin infection niya, it developed to a certain type of cancer. Mayroong specific type of cancer ang nade-develop doon. We have your Kaposi sarcoma. So doon, yung mga full-blown versions or parang class S versions ng disease, nagkakaroon sila. Resistant na infection, gano'n. Chronic diarrhea by a opportunistic parasite like yung Cryptosporidium, gano'n. So, yun, kapag nagkakaroon ka ng ganyang mga sakit, usually they are considering a possibility na stage 3 HIV infection na to or AIDS. So, si stage 1, hindi yun AIDS. Stage 3 yun. AIDS. Okay? It's not, uh, it's not that in all, nang magte-test ng positive AIDS agad, hindi. Okay? So, if, only if, nagkaroon na siya ng severe form of the infections and mababa and document using your CD4 count or viral load, okay, then we can call it an AIDS, no? So, meron dito na download na pamphlet from CDC about AIDS. So, HIV 101. Yeah. So, how can it be transmitted? Yeah, sexual contact. Ay, ito pala, yung sharing of needles. It's important. Yung mga IV drug users. Okay? And then, also yun, kung yung female infected, tapos nanganak, the child could contract also AIDS. Or, sorry, scratch that. The child could contract HIV. Okay, not AIDS. AIDS again, third stage. It's not transmitted in the air or water. Ito yung misnomer, no? It cannot be transmitted through saliva, sweat, or tears, or close mouth kissing. It cannot be transmitted through pets and sharing of toilets. Okay? Hindi doon ang transmission. Low risk yun. How do you protect yourself from AIDS? Yun. Practice safe sex. Okay? Using barriers. Use condom right away every time you have anal or vaginal sex. Choose activities with no risk of oral sex. Okay? Don't inject drugs. And then if you engage in behaviors that may increase your chance with HIV, your healthcare provider, ask your healthcare provider to have pre-exposure prophylaxis. Right? That is right for you. Well, we have pre-exposure prophylaxis. Just as long as you tell your doctor, okay, if you need them. Keep yourself healthy and protect others if you have AIDS. Okay, if you know how you contracted the infection, you have the right idea on how to prevent it from spreading from others. You have the responsibility for those who have the infection already. Okay, again, HIV is the virus. HIV infection is the disease, okay, or the entirety of the disease. AIDS is the serious stage of the HIV infection. Okay, AIDS is the acquired immunodeficiency syndrome. No, so that is yung acquired immunodeficiency syndrome. That is the last stage of your HIV infection. Sige, haba ng topic ko, 30 minutes. Sorry. Anyway, hopefully maganda yung discussion. Maganda pang pag-aralan eh. Siguro tingnan natin about kung sino may mga nagkaroon ng HIV infection in the Philippines. There are certain advocates and then certain groups that would help us uh, know the infection better, how it's contracted, tapos what are the steps that are usually done over the past years. And pinaka-importante is yung awareness and prevention. Kasi kung alam mo naman na ito yung reason bakit nagkaroon ng sakit, bakit mo pa gagawin? And if you have already the infection, bakit mo pa i-risk giving it to the people that you love kung and bakit mo ito tatago? Isa pa yon. So, if you have the infection and if you have a partner, tell him or her right away before indulging in any sexual activity. Kasi kung mamahalin ka niya, despite of the infection, mahal ka niya. Okay? It's not that you're afraid. It's how you love the person. And he or she will accept you if you have this condition. And you will fight it. You will know how to go about the infection or this condition if mahal ka talaga ng tao. Kasi tatanggapin ka nila. Okay? May nabubuhay ba na may HIV? Yes, meron, maraming mga tao. Actually, kaya nga may mga advocates. If you have the condition, okay, we have certain treatment facilities. This treatment facility, yung kwan naman, yung hubs na 'to, hindi naman actually for cure, 'no? It's just to, ano 'to, to control, help you control the viral load and will not and but will not cure you. As of now, may nasabi last time na meron daw na-discover na bagong, drug, pero it's not still it's still not yet, available for the public. And if meron man talaga, then that maganda rin yung pag-usapan. And siyempre kailan siya maging available, that is one. Kasi it's novel, innovative, and very helpful kasi HIV is actually, this is the longest pandemic, okay? The longest silent pandemic, yung HIV. Kasi dami nang namatay because of, the complications of HIV. Okay? Sige. Uh, Again, wala siyang cure pala. I mean, wala siyang cure, but we can control the viral load and help the people infected with HIV not go through the last stage. Basta maging healthy sila and ma-avoid nila ang serious infections. Sige. 37 minutes na. Thank you for watching and hopefully may nakuha kayong may mga information regarding our topic. I'll discuss other topics siguro in the later parts over the succeeding days. And sa mga nanonood, thank you for watching. Do like, share, and subscribe to my channel. And yun, nag-start pa lang ako ulit. Start ako eh. And gusto ko ito patuloy-tuloy if eventually, lalo na after residency, para lang mag-provide ng good health education. Sige. This has been Doc Chris, the Scrubby MD, signing out. Antok na, gutom na rin ako. Where's my outro? Outro.